Hi, I'm Becca Kennedy,
And I'm Howard Schubiner.
and this is the science behind the symptoms, where together we will explore the new science of neuroplasticity through a lens of curiosity.
And we are a podcast of the Association for the Treatment of Neuroplastic Symptoms, known as the ATNS. So today we're going to talk about what?
We are going to talk about placebos and nocebos.
Ooh, my favorite topics.
It's very important, for sure.
Yeah. Yeah. Like, what is a placebo effect? It's talked about a lot, and I think it is really misunderstood by
Mm-hmm.
doctors and by everybody. Doctors have this view that a placebo, of course, is defined as a positive event that occurs when taking a substance or a medication or some kind of treatment, but the positive event is not caused directly by the treatment per se. It's caused by the brain. It's caused by the expectation that the treatment will work. And then the effect is a positive one that people's symptoms improve. And it's probably seen in every treatment probably has some amount of placebo effect involved with it. But the question is kind of like, how powerful can that really be?
Mm-hmm. Yeah. Yeah. Exactly. Yeah.
Because a lot of doctors say, "Oh, yeah, 1/3 of people will have a placebo effect that occurs for 1/3 of the symptoms. It'll help a little bit, but not too much, and it'll last a short time." And that's kind of a standard line, but that's not true at all. I
Mm-hmm.
mean, a placebo effect can totally reverse, can be 100% effective in certain situations, especially when there's a neuroplastic condition. In other words, no damage in the body. Somebody can get a pill or something. I have a friend who's like, okay, if I take my one little, NSAID each morning, I have no back pain. If I miss it one morning, I have back pain all day. I'm like, really? Okay, that's possible, you
Yeah.
know, but I really think it's a placebo effect.
Well, I think also if we really look at how long the ibuprofen could work,
Right.
and, it works for a few hours, but it wouldn't actually have a therapeutic benefit in the body all day. Kind of putting
Exactly.
together all those pieces.
Exactly. And a placebo effect occurs. There's a few things that I've noticed. For one is there's an explanation for, you have a stronger placebo effect when there's an explanation for the problems. Like, okay, the problem is this, you have a deficiency of a certain vitamin. That's the problem. Treatment. Okay, we've got that vitamin. And then the person giving it is a caring, trusted person, and they offer hope. And then it works. It has a higher chance of working. It may work for a long amount of time and might be a really powerful effect because if the problem is neuroplastic, it's due to learned neural circuits in the brain, and you change the neural circuits in your brain by a positive expectation and making the brain feel safe. Okay, this will do it.
Hmm.
It can have a very positive, very powerful effect.
Yeah. And I think it's a really important point, kind of what you brought up before rolled into this, is that the placebo effect often is assumed, like you had said, that it just has a little bit of an effect. It just has a mild effect, is what all the placebo effect can do. And so sometimes people say to me, well, I had a huge effect. So it couldn't possibly be the placebo effect. Well, it doesn't matter how big the effect is or not, it still can be created by the brain. And that's the point and what randomized controlled trials do, where they compare the medicine or the procedure or the intervention to a placebo. And the placebo means that it's known to not have any particular, specific change in the body. It's a sugar pill or, something like that. But that the placebo arm of a study, for instance, shows the complete effect. Like the person is 100% feeling the effect to the same degree as the person that actually took the substance. So the degree of the effect can still be placebo. It's not a smaller effect necessarily.
Yeah, exactly. And there's experimental data on this. That's really interesting. For example, with pain, there's one study that was done where they gave people experimental pain, and they gave them like heat to their arm, and they would give an increasing amount of heat, and then they would say, how much pain do you have? How much pain do you have? And then they gave them a pain pill. And half the people, they were told that this pain pill costs 10, and the other half, they were told this pain pill costs $2.50 per pill. The pill that they got was a placebo. None of the
On
pills
both sides.
on both sides. Yeah. None of the pills had any effect, in terms of biological activity. But what they found is that at every level of pain, the people who got the expensive pill reported much less pain than the people who got the inexpensive pill.
Mhm.
Really, really a kind of cool study showing the power of the placebo. And we know the color of the pill may matter.
I was gonna say. Yeah,
White pills have higher pain relief than colored pills
yeah.
in studies. Creams have higher benefit than pills.
Mm,
Yeah. Injections have higher benefit than creams.
mhm.
Guess what has higher benefit than injections?
Surgery.
Exactly.
Yeah,
Surgery.
like the quite a few years ago, they did the sham surgery for knee pain and found that for what was the
It was for knee arthritis.
oh, yeah, knee
Yeah.
arthritis.
And there's two studies of sham. One was knee arthritis and one was meniscectomies.
Right, yeah, yeah,
Yeah.
yeah, and the sham surgery was found not to be better than real surgery.
Right.
That
They
they
were
both
the
had
same.
benefit. They
Yeah.
both
They
had
both
benefit.
had, they both
Yeah,
had really pretty strong benefit, actually.
yeah, yeah.
Of course, my brother's an orthopedic surgeon. He said, see, the surgery works. People had much less pain. And I said, yeah, but the reduction in pain was due to the placebo effect. And he said, so that's still good. We have a surgery that works. Maybe it's a placebo surgery, but it works. Everyone's happy. Patient's happy. He's happy. But, there's risk to doing procedures
Mhm.
like Botox is another good example. When you give Botox injections for migraine, you can reduce the average reduction of migraine days per month was 6.5, which is
Mhm.
pretty good reduction by six
Yeah,
days per month
right.
on average. But the placebo arm had 5.5 days reduction,
Mhm.
just about the same.
Yeah, right.
The effect was 90% of that effect was
Mhm.
placebo and not due to the actual medication.
Howard, I think that's such a good point, and maybe you could talk a little bit about the difference between when they do a study and they find that it's statistically significant benefit of the intervention over the placebo, then that's what they need to do, generally speaking, to get some procedure or medicine approved.
Right.
But there's a difference between being statistically significant improvement versus clinically significant.
Yeah.
Can you talk about the difference? Because I think that's really important.
Yeah, yeah. Well, a good example of that is antidepressant studies. There's a lot of antidepressants, and there's hundreds of studies of antidepressants for depression. And when you look at the data of the studies that have been published, you find that the initial response rate for depression for antidepressants is about 75%. Most people have a good response initially to an antidepressant.
Yeah. Yeah.
So one would say, wow, that's pretty good. They must work really well. So, but the question is then, well, what's the response in the placebo arm?
Yeah.
So if you look at the data on antidepressants versus placebo in the published studies, it's pretty big. The 75% versus, like 60% or 50% or something. It's a pretty significant difference, 25% different. Now, our colleague, Irving Kirsch, works with Ted Kapchuk at Harvard. He was doing that. He did that analysis. And then someone said, hey, Irving, why don't you look at the unpublished studies? And he said, oh, what's that? Well, all research studies that are done in the US have to be reported. The data has to go to the FDA.
Mhm.
You don't have to publish the study. So if you're a pharmaceutical company and you're doing a study on an antidepressant and it shows that it didn't work, they didn't publish it.
Mm.
So, so I was like, okay. So if you only look at the published studies, the results looks better. So Irving got all the unpublished studies from the FDA, and then he put them all together, all the studies. And
Mhm.
instead of 75 versus say 50%, it was 75% versus 72%.
Wow, amazing.
And a lot
And
of the
that's
studies
also
were
that
negative.
the placebo arm of the studies showed 72% benefit of that.
Exactly.
72% of people felt better,
Exactly.
but just from a sugar pill, not
Exactly.
the actual medicine.
Which means two things. One, most depression is neuroplastic
Mhm,
because conditions that have a high placebo response rate, like migraine, like depression,
mhm.
are likely to be neuroplastic.
Right,
Number
which
one.
means that it's generated in the brain as neural
Exactly.
circuits without structural damage in the body as the generator of the symptom.
Exactly. The other point that what you brought up initially, Becca, is that the 75 versus 72% is a very little difference, very
Mhm,
small difference.
mhm,
It might be statistically significant in the
mhm.
sense that the difference is unlikely to be due by chance,
Yeah.
statistically, if you have a large number of patients, but clinically difference is very low.
Mhm.
And it doesn't really make up enough difference to it's not to justify taking it because it actually works, but to justify, I don't know, even approving it. Like a lot of people who've written about Botox were like, why is this approved?
Yeah,
You know?
right. But so 72% of people who take this placebo get better. So then what's the problem? Who
Right,
cares?
exactly.
I
That's
mean,
the
you're
same thing my
better,
brother was saying.
right? So what are some of the problems of taking a placebo and getting better from a placebo?
Well, there's not a problem when you get better and you don't need any more treatment. For example, we did a study with back pain, and in that study, one of the patients who came into the study had severe spinal stenosis.
Mhm,
And the doctor, our colleague Bill Lowry, who was running the study, looked at him and examined him and looked at his MRI, and he thought, well, this looks structural. This is pretty severe. The pain never shifts. It never moves. It's always in the same place. It's always triggered by the same activity. He said, I think this is structural. Fine. So then this guy goes to get injections. So for spinal stenosis, the idea is that the pain is being generated by pressure on the spinal nerve roots coming out of the spine, which would actually mean the pain would typically be in the legs. And it was on both sides. So theoretically, he'd have pain in both legs. Well, he had no pain in his legs.
mm,
Well, he had back pain. But anyway, so they do the epidural steroid injections, no effect. Should have helped, but it didn't. So they go, well, we have other injections we can do. Let's do facet joint injections. And facet joint injections are the little joints that where each vertebrae is connected from top to bottom to the next one. And that's where spinal arthritis would be.
mhm.
So they do those injections at 6 different areas, and with lidocaine, pain goes away. Now, the purpose of that injection is to see if the pain goes away, because if it goes away, that suggests that's the cause of the problem. And then we can do a second procedure, which is ablate those nerves, destroy those nerves to cure the pain.
And just to be clear, because lidocaine is an anesthetic, and
Exactly.
lidocaine only has a very short duration. It actually just lasts for, like, a few hours or something like that.
Exactly. Yeah. 4
And then
hours,
it and
maybe.
then the effect of it's like, what you get when you go to the dentist. Yeah, it's numb for a few hours, but then the effect of the medicine wears off. So it's just
Exactly.
temporary.
Exactly. So his pain went away, period, from the
Like, it
lidocaine.
didn't come back. Like, it went
He
away
didn't
for
come back, no. A week later, a month later, 6 months later, he's fine. He's like, "I'm cured," and that's great,
yeah.
but that was due to a placebo effect, and actually, Dr. Lowry probably was wrong about the cause of his pain because it probably was neuroplastic.
Yeah. And again, because he got at the lidocaine, which only numbs the nerve for a couple of hours, but his pain ended up going away permanently.
Yeah,
But
right.
so there's nothing so when we understand the mechanism of how medicines work and what the expected outcomes should be, it doesn't make sense that that outcome would happen with just lidocaine.
Exactly. So what's the downside? The downside is, well, we keep doing more and more of these injections because they're having a good effect, but we're not understanding that it's a placebo effect. And we're not understanding that maybe this person could get less invasive treatment, like
Right, so there
neuroplastic
can
treatment.
be risk of the procedure. So,
Exactly.
an injection or a surgery is not without risk. Some of
Exactly.
the medicines can cause side effects, or some of the medicines that we give people can actually put people a little bit at risk. So if they're getting better just from the placebo response, it's not great. We want them better, right? Don't exactly care how they get better. We just want people to get better. But if it's putting them at risk or they're having side effects, can be one of the reasons that it's problematic.
Right. Or it wears off. You get an antidepressant, it works fine. And then a couple months later, oh, it's not working. Well, let's give you a different medication or
Right,
another medication.
right, right,
And now you're talking, and then
right,
and then you get into this thing. Well, you've had recurrence of depression. Now you have treatment resistant depression.
right,
Now that's a whole
right.
nother thing. And that's
And it
causing
can
fear.
And it can really set up that if we're taught that the only way that you can get better is through something external like a medicine, but then that medicine isn't working and now you've tried all of these different medicines and none of them are working, but you haven't gotten the empowerment and the understanding that there's a different way to get better from the inside, then now the fear can actually increase even more and more and more. Now that we're getting to the end of our rope, that we've tried all these different medicines and they're not helping, and then people can really be stuck in a fear loop.
Exactly. But when you realized that you have gotten better by a placebo effect, that in and of itself can be empowering.
Mhm.
That can mean like, "Oh my goodness, well, now I can do this. I can become my placebo in a sense. I can," because the placebo is about changing neural circuits in the brain.
Mhm. Mhm.
The idea is we have the power to change neural circuits in our brain.
Yeah.
You know, we were together last week, and a young woman came up to me. She's had this horrible back pain. She's got scoliosis. She's really thinks it's a structural problem. And she had a weird, I don't know why I'm telling this story, but she had a weird thing happen. She took some psilocybin and her pain skyrocketed up, went really high
Mm.
from the whatever, the effect or the fear of taking it or whatever. And then the guide came over and he saw she was not doing well and he put his hand on her shoulder and the pain disappeared. It was
Amazing.
amazing.
Yeah.
And I'm like, "You're worried about your back? That just showed you you
Yeah.
don't need to worry about your back." That was a
Right.
powerful, powerful, and we'll talk about nocebo in a minute. That was a
Mhm.
powerful nocebo effect where things got worse because of
Yeah.
the medication,
Yeah.
and then it got better when you were put in a
Mhm.
powerful place of
Yeah.
safety. So,
Yeah.
to me, that was like, we
Amazing.
just solved your problem, or at least we solved the diagnostic.
Yeah. Right. Because it went away completely.
Yeah,
Amazing.
exactly.
And that's the other thing is I think sometimes people think, "Oh, well, I'm not susceptible to placebos." That's, other people, and sometimes I think it's thought of as that people are weaker that are susceptible to placebo. And I don't think that's the case. It's just about our brain. It's just what our brain believes, but it's not necessarily what just our conscious brain believes. It's really
Exactly.
about what our unconscious brain believes. And again, people say to me a lot, "Oh, well, I didn't think it would work, but it did. So therefore, it couldn't have been the placebo." But again, it's not about what your conscious brain believes necessarily, although that helps. But what the unconscious brain, I had the placebo effect. I mean, probably all the time I have the placebo effect working on me. But back when I was working in primary care full time and my kids were young, and I would get a tension headache like at 3 p.m. every day on weekdays, pretty much for months and months and months. And so my colleague prescribed nortriptyline to me, which is a pretty common, it's an antidepressant, but it's a common preventive medicine for headaches. And it was this tiny little dose. I mean, tiny, tiny little dose. And my experience as a physician was that this actually didn't really help people very much. And so I was like, Fine, I'll take it. I actually don't think it's going to help." And I was getting these headaches every afternoon and every night. And the first night I took it, no headache.
Wow.
And then the second, I was like, "Oh, this is great." And then the second night I took it, no headache. Third night, no headache. I was like, "Oh, all right, I'll keep going on it." And then my headaches came back. And that's the thing about a placebo is that, again, if it helps permanently and that there's no side effects and there's no problems, absolutely, like, why not? It's awesome. But the problem is that often it might help initially, but if it's just due to the placebo effect, often the symptoms come back again. And then when you roll in all the other problems of side effects or and then if people believe that they must have this external treatment, and then that can detract from understanding that people can have the power within themselves to make the change.
The placebo effect can work when someone is given a pill and told that the pill is a placebo.
Yeah.
It doesn't it doesn't act usually the placebo has some amount of deception in it in a sense that we're saying this is, this shot is for migraine or, this pill is for 3 p.m. headaches.
Mhm.
There's in a sense of deception but if you give someone a placebo and you say this is a placebo pill. This has been done in an irritable bowel syndrome study.
Mhm.
And this is a placebo pill. Take it 3 times a day. Placebos have been shown to positively affect different conditions such as irritable bowel syndrome. You're in a research study, and they go, okay, I'll take it 3 times a day. But there's something powerful about taking a pill because people have been conditioned that pill from growing from little.
Mhm.
You take a pill for this or that, and people are conditioned. Their brain is conditioned that the pill will help. So there's that. And then maybe that's why the creams, topical works better than pills because of Vicks Vapor Rub.
Yeah, right. But yeah, so interesting, right? Like you're saying that there are some studies that they have what's called open label placebo. Just like you're saying, they tell the person that they are taking a placebo. And some of the time, not all the time, but some of the time, it still has the therapeutic benefit. They still notice the positive improvement. And
Right.
fascinating, just fascinating.
And then another part of the placebo effect is having a caring and trusted provider.
Yeah.
And so one of the studies they did, this is again Ted Kaptchuk at Harvard, did the study with acupuncture for irritable bowel, I think it was. And they had one acupuncturist who was trained to be caring and kind and considerate and hopeful. And the other acupuncture was just brusque and you hear stick the needles in and walk away.
So sad.
Yeah, it's horrible. So, but the results, like 64% of people improved in the caring acupuncturist, but only 44% improved in the uncaring acupuncturist. So, a big difference on that part of what goes into placebo effect.
Interesting. Yeah. And what about sham acupuncture studies?
Well, it's funny about that study. That study was sham. Both groups got sham acupuncture in that study. It was pretty funny.
Oh, so it was sham
But a
acupuncture.
lot of studies have shown, there are studies that have shown that sham acupuncture works pretty much as well as real
Mm,
acupuncture.
yeah, yeah.
Um,
So interesting. So it's sham acupuncture, but still 40, you said 44% of the people got better from with the brusque person, but what was it, 66 or so?
64%, yeah, 64.
64%. So 64% of people got better. Again, their experience in their bodies was
Yeah,
improvement,
yeah.
but just sham acupuncture.
Right, and so I'm not against acupuncture,
Yeah, right.
I'm not against things that invoke the placebo effect. If you do it in a way that's not super invasive, not super expensive,
Mhm.
that helps people heal, maybe, we've trained, a lot of people in our work who are non-physicians, who are physical therapists, who are massage therapists, who are acupuncturists, who are chiropractors, et cetera. And so, one of the things that I think people can do is practitioners can use the placebo effect to their benefit.
Mhm.
When I give someone a medication, well, I don't actually do that, but I used to do that. But the idea is when you give someone a medication, you want to say, well, this medication is specifically for you. It's for the condition you have. I expect it'll have these 3 positive effects. And they say about the side effects. Well, all medications can have some side effects, and these are some of the ones that are common, but they're kind of at a low rate. Most people don't get them. And I'm expecting that this treatment will work for you. So you're giving like a sandwich where you're
Mhm.
having positive expectation, which enhances the
Mhm.
placebo effect. And you're trying to be honest and truthful, but minimize the
Yeah.
nocebo effect,
Yeah.
which we
Yeah.
should talk about because the nocebo effect occurs in all medication trials, doesn't it?
Well, yeah. So what is the nocebo effect?
So the nocebo effect is when you get a medication and it causes a side effect. But if you're getting a placebo medication and you get a side effect, then we know that the side effect or the adverse effect is not due to the medication. It's not an actual side effect because you
Mhm.
got a placebo pill.
Mhm.
Every all medications that have been studied for approval have gone through this process of placebo, comparing the medication to the placebo. And all the companies have to compile a list of all the negative effects that
Mhm.
occur. And when you look at the package insert, it's amazing to do this.
Mhm.
They, well, 33% of people had headaches on this pill, but, 29% of people in the placebo group had headaches
Yeah.
or muscle aches. Like you look at statins, for example.
Mhm.
The statin, the anti-cholesterol drugs, well known, well studied. One of the main side effects is muscle ache. But when you actually look at the studies, people in the placebo arm of these studies had just about as high muscle aches as people in the statin arm of the study.
Interesting. And again, just to be clear, that means that people who took the sugar pill that had none of the actual medicine, be the same as, eating a Skittle or an M&M without peanuts. But that sugar pill actually resulted in people experiencing in their body side effects, the pain or whatever, headaches, whatever other sensation. And that was happening without the medicine itself.
And we know that nocebo effects are more likely when there's fear of taking the medication.
Yeah. Right.
Or, of course, certainly could be there's more stress, ongoing stress or trauma
Yeah.
in people's lives at the time,
Mhm. Yeah.
but specifically fear of the medication and fear of the side effects. I don't know how many
Mhm.
times I've seen people, well, I really didn't want to take that medication, but this because of these side effects,
Yeah.
then I took the medication. And I got all these side effects.
Yeah. Right.
And that's particularly true for the COVID vaccine, where there was a ton of fear
Mhm.
about that
Yeah.
especially when it first came out.
Yeah. Yeah. And it's interesting to look at the COVID vaccine trials because one arm of it was a placebo vaccine. So people got an injection, but it was just saline. There was no vaccine, no medicine at all in it, and still a high percentage of people experience side effects. So
Exactly.
in the placebo side, there was 25% of people experienced fatigue without getting the COVID vaccine itself. People who got the COVID vaccine experienced fatigue 40%. People that experienced headaches, it was 25% in the placebo arm of the COVID vaccine versus 35% in getting the actual vaccine. Muscle aches, it was 12% of people got muscle aches after getting the placebo vaccine versus 25% of the actual vaccine. And again, it's not that they only got a little bit of the symptoms versus bigger symptoms. They got the same amount of the symptoms. They weren't able to distinguish,
Yeah.
without actually knowing specifically what they received.
Yeah, the nocebo effect can be powerful. So someone could get extreme and severe fatigue who got the
Yeah,
placebo vaccine.
yeah,
And
right.
what's interesting is that when you think for example, 40% of people who got the actual vaccine had fatigue.
Mhm,
Well, and 25% from the placebo vaccine had fatigue. So when you think about that, it's not correct to say that the vaccine caused fatigue in 40% of people. It's
mm,
actually correct to say vaccine caused fatigue in 15% of people,
mm, yeah,
most likely because 25% of people in the COVID vaccine arm
yeah,
probably had fatigue
mhm, yeah,
because of the nocebo effect.
yeah, right,
And
yeah,
what's interesting is that there were more when they did these studies worldwide. So we're talking about 40,000 some people who got COVID vaccines versus placebo. And what they found is that the nocebo rates were higher in the United States than in some of the other countries.
Mm,
right?
fascinating.
And what was going on in the United States
Mm,
about the COVID vaccine,
yeah,
a lot of fear.
a lot of fear. Yeah, a lot of sort of conflict around the beliefs of if we should get it, if it's safe,
Exactly.
so much that was really emotionally charged.
Yeah.
Yeah.
And the other thing they found over time is that the nocebo effects of the COVID vaccine, in other words, the group of people in the placebo arm who had side effects, was lower on a second injection, a second vaccine versus the first vaccine,
Interesting.
which
Wow.
probably reflects less fear. You already
Yeah,
had the first one. The
yeah,
reason you're getting the
absolutely.
second one is you did fine on the first one,
Yeah,
less
yeah.
fear, less
Mhm,
nocebo effect.
mhm. Wow, fascinating. Yeah. And so when we do a randomized controlled trial to get a medicine or a procedure approved, the whole point is to see if whatever they're trying to get approved and to see if it's safe and effective is to compare it to the placebo to know is it better than a placebo. So that's why we're doing it. And I think one of the fallacies that I think a lot of people have is that whatever medicine that doctors are recommending or procedure, we know absolutely scientifically that this is 100% or, really good, that this is effective and that we all agree on this, or, that's often a belief. But really, the amount of procedures and medicines and things that we do in medicine, I mean, it's a good faith effort. I mean, no one's trying to cause harm, but it's hard to do scientific studies and it takes time and money. And so a lot of the medicines and the procedures that we do haven't necessarily been completely scientifically validated, the best that it possibly can be. And
Yeah.
as we go through time and there's more studies done, then it might be uncovered that a particular medicine or procedure is found not to be effective where before we thought it was. And I think it's really important to understand that no one, for the most part, is trying to be deceitful, or no one is thinking that they're saying something and they know it's not helpful. Is that, as a doctor, I'm seeing a patient and I give them some treatment, and then it's an N of one, which means
Right.
that it's just one person. And my experience is then maybe the following week they come back and they tell me and they say, oh, I'm better. So now, as the clinician and the patient, our lived experience is we attribute the treatment to the cause of why they got better, but we don't actually know because we haven't done a randomized controlled trial. And clinicians in every aspect of medicine they are all experiencing seeing their patients get better from certain things, and again, we assume that it's our intervention that's the reason that they're getting better, and maybe a supplement or again a procedure or a medicine, and they come back, they tell us they're better, and then we say, "Oh, well that really worked. Well, that's great." And now if someone else says, "Well, no, that actually doesn't actually work," then their own lived experience is counter to that. But their own lived experience does not distinguish between the placebo and the actual therapeutic benefit.
Right. The only way to do it, the only way to know is by doing studies. And to that end, we should probably do an episode on procedures for back pain.
Ah,
There are a whole list of procedures for back pain that have been used for many years. I'll just do a little spoiler for that
little
example.
teaser for the future.
Most of those, when you look closely at placebo responses, have not been found to be better than placebo, but we'll talk about that
Yeah,
in the
yeah,
future.
yeah. Well, what are studies that you know that show the nocebo effect more specifically?
Well, I think the main ones are the ones we've talked about. You might think about another area has to do with back pain. And when someone gets an MRI can have a nocebo effect
Yeah.
because, of course, 90, depending on the population you're studying, if you're studying a middle-aged population, as we did in our backpain assessment study, 98% of the people had abnormalities on their MRI.
Mhm.
We found that only 12% of people actually had a structural problem
Mm,
causing their pain. So a
mhm.
huge difference. And so there was a study from Britain where and the reason, of course, for that is that abnormal findings are seen in normal, healthy people of their back. So we know that,
The majority of people, normal, healthy people have MRI abnormalities,
right,
normal abnormalities.
right. Depending on age, it rises with age. 20 year
Yep, yep,
olds,
yep.
only, only a third of 20-year-olds have abnormalities who are
But
healthy.
only a
So
third,
that's a high
a
number.
lot, right? And then nearly 100% of 80-year-olds
Yeah,
in their
right.
80s have abnormalities that are reported on the MRI finding.
Absolutely. So anyway, so they did a study in Britain where they did MRIs on people and they randomized them to have either a a report of their MRI, which in one half said, "Here's your MRI findings. You have this. You have degenerative disc disease. You have bulging disc. You have nerve compression. You have spinal stenosis. Here's what you have." The other arm, they randomized to say, "These are the findings on your MRI, and we would note that these findings are also commonly seen in people without pain as a function of age." That was the difference. So just the differing report of what the MRI interpretation of the report was different. And in the group that got the regular MRI readings, they had much higher rates of pain.
Mm,
At higher 6 weeks later, they had higher pain. They had more procedures done. They had more fear.
mhm.
Whereas the group that was simply given their MRI report, which said, it's kind of like a normal finding. They had less fear, less pain, and less procedures done. That's a huge difference. So
That is a huge difference.
right, so MRIs are nocebo for
Mhm.
most people,
Can
actually.
be. Mhm. Right, because once you read some abnormality in black and white, it's so official, and
Yeah,
it's really hard to get that out of your brain that you're
yeah,
not damaged.
yeah, and then the doctors often are saying, "You've got you've got the back of an 80-year-old. That's a nocebo statement. You're gonna be in pain for a long time. This is not fixable. There's nothing we can do." Those are all nocebo.
Mhm. I've also absolutely in the power of our words, especially a specialist and someone that's really revered and really believed I've seen a lot that doctors I probably unfortunately said these sort of things myself, before I really knew is that setting someone up for developing symptoms and if they have a broken ankle or they have some injury is that sometimes they're given messages that well, you'll heal up, but you'll probably start developing pain in 5 years or 10 years. And then I've seen many patients that sure enough, 10 years later, now that they started getting pain, and again, that information that was planted in there.
Yeah, that's why when I was seeing patients, I always wore a tie. Because I felt like I needed to be as authoritative. I didn't wear a white coat because I never liked wearing white coats, but I felt I needed to be as authoritative as I could be to counteract
Well,
the word.
people would believe this podcast a lot more, Howard, had you worn a tie today.
I know, I'm thinking that now.
Next time, next time.
Next time, next time. So,
Yeah.
let's kinda wrap this up. I wanna tell a story about a true story, of course, about a guy who had he was in a research study for depression.
Mhm.
And research was an antidepressant. So he got a bottle of pills and he got very despondent and he took the whole bottle of pills.
Hmm.
And
So he was just depressed and he
he was
was,
he was suicidal.
yeah, trying to kill himself and took the
Exactly.
whole bottle of pills.
Yeah. But he went to the hospital himself. He didn't just stay home, which was a good sign. And he came to the hospital. He said, "Help me. I took the whole bottle of pills."
Mhm.
And they examined him and his blood pressure was low
Mhm.
and he was out of it, not clear,
Mhm.
very weak, very tired, low blood. They admitted him to the hospital. They're giving him IV fluids to keep his blood pressure,
Mhm.
up so that he was okay. And they were concerned about him, obviously. And they called. He said, well, "What did you take?" And he said, "I don't know. I'm in this research study."
Mhm.
The bottle of pills doesn't say what it is, but the bottle of pills has
And
a
so
phone
did
number.
was he admitted to the ICU?
I think he was in the ICU. I
Yeah,
think
which is
blood pressure
very
was low.
severe. Yeah, because his blood pressure was so low, they were very,
Yeah,
very
I
concerned
think so.
about his
Yeah,
health, and they were needed to monitor him. Yeah.
yeah. Um, so they called the doctors called the research center, and they said, "Well, what pill is he taking?" And they looked it up and they said, "Oh, he's in the placebo arm of the study." Wow.
Yeah, amazing. Wow, so he had basically eaten like a bag of Skittles or
Yeah,
just had sugar pills, no medicine at all, and it had this profound effect on his symptoms, his actual blood pressure,
right.
that the ER doctors were very concerned about his well-being.
Exactly.
Yeah,
Yeah.
amazing.
Now, when he found out that he had taken the placebo, he made a pretty rapid recovery
Hmm. Well, that's good.
because I
Amazing.
mean, yeah, he was, oh my God, thank God, I'm okay. And his blood pressure came up. He didn't need
Amazing.
the IVs. So
Wow.
with never underestimate the power of the brain. That's right.
No, it is amazing. Absolutely. Well, fantastic, Howard. Thanks so much. Some
Thank
great
you.
information.
This was fun.
Yeah.
The placebo and its tricky twin, the
Yeah.
nocebo, right?
The placebo and the tricky twin, nocebo.
Right, exactly.
Exactly. It's tricky. It's all very tricky.
It is tricky, but it's fascinating, endlessly
Yeah.
fascinating.
Yes, absolutely. Awesome. Well, great. Well, thanks for joining us, everyone. We look forward to having you at the next episode. I'm Becca Kennedy,
And I'm Howard Schubiner.
and this is the science behind the symptoms. See you
We
next
are
time.
we are a podcast of the ATNS. See you next time.
Bye bye.